Hi parents, let's talk about lateral lisps. So if you are receiving this video, your child has a lateral lisp, and a lateral lisp is, there's two types. There's a developmental lisp, which is normal up until a certain age, and then a lateral lisp, which is never typical. This is an atypical habit that is learned over time, and so when our tongue wants to produce S, Z, CH, SH, and J, the sides of our tongue kind of have to come up on the edges, these sides of our tongue. They have to curl upward. And what happens with a lateral lisp, so that the air can funnel forward, what happens with a lateral lisp is that the tongue kind of doesn't do that. It lays flat, and therefore the air flows out through the sides instead of funneling forward. So one of the things that we teach is placement. And because this is a learned behavior, it does take a lot of drilling and practice to kind of correct. So in order to support your child, I am sending home a home exercise program that contains a word list. It'll be printed out and put into a pocket folder, a little pocket protector, for you to play tic-tac-toe if you want, or hang it on the mirror if you'd like, and do it at teeth brushing time. There's also a fun activity. In this case, it's a puzzle. These are minimal pairs. In other words, one sound changes. So crush, crutch, wash, watch, share, chair. So you see how only one sound changes. So you will get a fun activity, either matching cards or a puzzle, something like that, and a word list. If you could practice this with your child once a day, that would be wonderful. That will help with repetition and practice and just consistency. When you are helping your child practice this word list, it is very important to provide the same cues that I'm also providing in therapy. And so one of the things for crush, we call it the quiet sound. Our lips are puckered. Shh. Our tongue is pointing, the tip of our tongue is pointing upward. Shh. And sometimes I use this cue, shh, the quiet sound. For CH, it's a little bit different. It's a harder sound. So the T and the SH together make the CH. Because inside of our mouth, what's happening is that the tongue tip is tapping, pushing upward, and that air is flowing forward, similar to how SH is. So it's kind of got a harder touch to it. So I tell them, tap that tongue, tap the tip of your tongue. Don't forget to lift that tongue, push upward, push harder, right? So that's kind of where we get with the CH, so that they can imagine that movement. If you want to practice this however frequently you want, that's fine. But there's a calendar included, and if your child marks 4 times per week for the month, then they can get a prize from the treasure box. That is a motivation that you can tell them about. And once you are done with the calendar, send the whole folder back. That way we don't have to remake this folder, and that way we can trade out the fun activity with something else, so that you can have a new activity for the following word list. That's all. So until next time, let's talk.